I have been waiting 20 years for a solution to our lead pipe issue here in Rhode Island. I'm really excited to be here today. I'm Representative Rebecca Kislak, and I represent a piece of 02906 that we just heard David Morales talk about. And when I started working with clients who had lead poisoning nearly 20 years ago, I was taught that we have a big problem in Rhode Island with the paint, and we had a lawsuit to address the paint issue. I also asked at that time, but what about the pipes? Aren't they mostly lead? And at that time, I was told that we were fortunate that we didn't think it was much of a problem then. But now our pipes are 20 years older. We know more, and we see what happens if anything goes wrong, like in Flint, Michigan. We need to replace all of our lead pipes now, and I'm really excited that we have a plan to do it. In fact, the pipes on my street are getting replaced right now, maybe right now. In fact, they were a block away from my house when I left. And we in my house have made the decision to replace the pipes in our house, but we shouldn't have that choice. Partial replacements are not good public health. Yeah. Maybe 10 years ago, a dentist came to me with the really scary, it's really scary and it's hard to understand, the scary mailer we all get in Providence every year that says there is lead in our water. And that poster behind me is also terrifying and a whole lot easier to understand than the mailer we get every year. We know that we can filter our water and we can take precautions and maybe it'll be okay, but it's still frightening. What are we drinking? What are we giving our children? The dentist was very concerned that her patient's mom brought in the flyer, and her patients didn't want to give their kids our Providence water at all. They incredibly reasonably want their kids to be safe from lead, and they were buying bottled water. But there's no fluoride in bottled water, and the kids were getting lots of cavities. Our tap water is best if it is safe to drink. It's fluoridated, which is great for our teeth. It is a great public health outcome that we can fluoridate our water. And it's inexpensive to go turn on the tap. We should all have access to inexpensive, healthy, safe tap water, but if it has lead, or if we're afraid to drink it, then it's a really big public health problem. And I'm here today to say it's time, once and for all, to make sure all of us in Rhode Island have access to safe and healthy water. To say that we shouldn't have to choose between fluoridated water and lead. To say that landlords and homeowners should not be able to make public health decisions for tenants or for the next family to buy and live in a house. I am so glad to be here standing together with advocates and colleagues, some of whom I've worked on this issue with for years and decades. We can fix this. We should fix this. We need to fix this. We need to replace all of our lead pipes, and this is the time to make it happen. Thank you.